Hello, my name is Dr. Dan Gottingham and I am the Cancer Lead for Vale of York CCG. Today I'm going to talk briefly about the ICE button and I'm using System 1 currently. I think you should be able to see my mouse on the screen. So what we do to get into ICE initially is click on the Path Request button. This then leads to this box coming up. The Gateshead option is for cervical smears. So we use the whole York Scarborough laboratories. Highlight it and then click OK. This launches the ICE home screen, and I thought I would just detail some of the functionality that we have within this button. This is on a test patient called Donald Duck, as you can see, but over here we have on the main screen we have the basic tests that lots of us order every day, and often we tick off this screen. What I wanted to highlight to everybody is the other options that it has in terms of both diagnosis and individual elements such as hematology and biochemistry. If you look at this top button here, what we're on at the moment is called custom requesting. If you go over to the right and click on test profiles, what's launched is another tier of buttons that help us to do different things. Here is the disease monitor register. So for instance, it tells me what bloods I might need to do for a type 1 diabetic review, as an example. Again, it's asking me when I did the HbA1c, etc. And also it asks all the normal buttons you get off the first tick screen. So is this patient on thyroxine? No. So what it highlights is what you would do for a type 1 annual review. This is useful for both clinicians and possibly receptionists who may be completing blood forms on the behalf of the clinician. If we then also go back further down this dial on the left, we see the diagnosis button. This asks us to do certain bloods when we are considering certain diagnosis. From my point of view as the Rapid Diagnostic Centre lead, or serious and non-specific symptoms, I could direct you just down at the bottom of these diagnosis buttons to the Rapid Diagnostic Centre. When I click that, it will tell me what I need to refer to the RDC. But just note there are other options on this page, including bloods for subfertility, acne considering Roaccutane, i.e. what bloods you do beforehand, what bloods you do for alopecia, erectile dysfunction, heart failure. So all these buttons are very useful. I'm going to come back to the RDC as an example. Over here we've also got drug monitoring. Statin monitoring is the only one on there. We've got smaller profiles and also buttons separate for TUV which currently don't have anything on them. But if we go back to the diagnosis button and we go and click on the RDC button, what we'll see is this immediately tells us that please also perform a urine dipstick and chest x-ray in meeting if you're going to refer on this diagnostic pathway. Now, at the moment chest x-ray is suspended due to COVID, but it just points you in certain directions. It also says that you may be meeting the criteria for NICE DG30 or DG11, which means you might go down the calprotectin or FIT pathway. Anyway, having seen that initial screen, we click on OK. This then goes through all the bloods that we want for the Rapid Diagnostic Centre, and if they've previously been ordered, it will tell you if they are within the last month or whether repeating it is necessary. All of them have been selected for this patient as he's male and greyed out as a CA125. We can then press OK. And all those buttons are done, and when we go back to continue with the request in the bottom left hand corner, we find that all the bloods are here ready to be done. We write on whatever we want to on here, so RDC, and click as we normally would do. I hope this is useful as an overview of the ICE buttons generally, but particularly with regards to RDC.